Hi everybody, I'm Lindsay Ferrier with CafeMom. Well, if there's one thing that you moms love to talk about, it's healthcare, specifically the Affordable Care Act. We had a chance today here at the convention to sit down with Health and Human Services Secretary Kathleen Sebelius, and there are a few things that she wants moms in particular to know about that Affordable Care Act. I'd like to ask you about this term, Obamacare. I mean, critics have always been using the term Obamacare to kind of ridicule the Affordable Care Act. Now the Democrats seem to be embracing it this week. Why is that?
Well, I think as the president said, he does care. It's one of the reasons he promoted comprehensive health care legislation. And he was not unique. For the last 70 years, we've had this debate in the country. Republican presidents and Democratic presidents have put proposals forward. He's the first one to sign a bill into law. And so he said, you know, I do care. It's Obamacare, and we'll embrace that notion and talk to people about why it is that this can make their lives and their families' lives a lot better.
Now that you have the opportunity to talk to so many moms out there, what are some of the things, some of the points of the Affordable Care Act that you would most want moms in particular to know about?
Well, as a mom myself and a brand new grandmother, my grandson was a month old yesterday, and I'm thrilled. I pay a lot of attention to women's health. It affects me, it affects my daughter-in-law, it affects my friends. And women are often the worst patients because we take care of everybody else before we take care of ourselves. We make sure our kids get their checkups and, you know, get our spouse's diet in place and keep him, you know, moving. But our own health is often a secondary thought. And that's unfortunately the way insurance policies have been constructed for years. The health needs that women have are often not part of the insurance coverage. So the snapshot before Obamacare was passed was women could be charged up to 50% more for a health policy that didn't even cover the services that we need. That really changes with Obamacare. Women will no longer be a pre-existing condition. We cannot be charged more in the marketplace. And thanks to recommendations from the Institute of Medicine, insurance policies will now include a range of health services unique to women. And for moms, there's some special things that often weren't part of coverage. So gestational diabetes screening, which is so important when you're pregnant and often can be a huge health issue, was often not covered in people's policies. All kinds of preventive care, breast cancer screenings, ovarian cancer screenings that can be critical to saving lives will now be not only available in health plans, but no co-pays, no co-insurance, to make sure that people get the preventive care they need. Lactation help and support. A lot of new moms want to breastfeed. We know it's better for the baby to build up those immunities. We also know that it's a big effort that helps against childhood obesity. Again, if you don't have an experienced helper around, if you don't know enough about it, you may be discouraged early on from breastfeeding your child. So lactation help and support, which has huge benefits for babies and moms down the road, is now part of health plans. Domestic violence screening, often not included. And in fact, insurance companies could actually deny a woman health insurance if she was a victim of domestic violence because she had a pre-existing condition. That changes dramatically. So Obamacare, the Affordable Care Act, has a lot of benefits for women. More affordable coverage, health services that we need and use on a regular basis, including contraception and maternity coverage.
So I hear all of these points, all of these great things that the Affordable Care Act will do, and yet polls show that there's still a lot of fear and resistance about this new health care plan. Why do you think that is?
Well, I think there was a lot of misinformation circulated as the debate was underway, and I think people still need to figure out what's in it for me. How does this affect me? Health is very personal. You know, our children's health, our parents. Women are also often, a lot of the moms who are listening today are often in the sandwich generation. They're taking care of their older parents. They need to know that the Affordable Care Act strengthens Medicare, keeps the benefits in place, and doesn't turn their parents over to an insurance company to try and negotiate their own rates. It has preventive care for kids. There are moms who are struggling with a child born with a pre-existing health condition. insurance companies will no longer be able to deny that family coverage for the child. A child will no longer have a lifetime limit on coverage. That's very good news. And then services for women. Going to healthcare.gov is a great website. It's easy to use, it's easy to navigate, and particularly for moms, there's a special site talking about health care benefits for moms and their kids, and it talks about the timetable that these new benefits will be in place. It's a very easy site to try and visit on your own time. We're not selling anybody anything, but we think people should have easy to use, easy to access information about the health care for yourselves and your families. Women are often buying the health care for their families. They're making the family decisions, and so they need the information to make the best choice.
All right. Well, I know you're very busy this week, Madam Secretary. Thank you so much for taking a few minutes to talk to us.
It's great to visit with you, and I hope that people actually visit healthcare.gov and learn about the law, because I think they'll be very pleased with not only the benefit package, but the opportunity to have more choices at a lower cost.
I know from experience that there are a lot of opinions out there about the Affordable Care Act. We want to hear yours. Leave us a comment here and let us know what you think. For Cafe Mom, I'm Lindsay Ferrier.